our core value is one of excellence. And that really is the drive behind our commitment to improving the quality and the safety of care for all the kids that experience CHKD.
We have a very important role in this community as the pediatric leader in the area.
We aim for greatness, but not necessarily because we're bad, but because we can all continue to improve.
Children are not little adults. They're not. They're unique. They have their own unique set of circumstances. They have their own unique healthcare needs, and it takes special people to do that, and people that are experts with kids and pediatrics to do that. And this hospital serves that purpose.
CHKD wanted to improve the delivery of nutrition to premature babies and reduce the risk of infection while delivering this nutrition to this vulnerable patient population.
We sent an email to Toyota North America.
We got a request for help. Our main mission is to give back to society by sharing the Toyota production system with nonprofit organizations and also small to mid-sized companies.
So when Toyota first arrived, there were skeptics.
And I was like, okay, this could be interesting. But I think the biggest part was bringing everybody to the table and watching the process evolve.
One of the main principles of the Toyota production system is a Japanese term called Kaizen. It means continuous improvement. It's the idea that many small improvements can lead to a significant result. However, before improvements can be made, there must first be a standard. Once a standard is created, employees are able to learn, train, grow, and find new ways to improve the standard themselves, to become problem solvers.
Many of our babies in the NICU aren't able to eat for long periods of time. They would literally starve to death without the ability to give them concentrated nutrition. We call this TPN, or total parenteral nutrition. TPN is like a balanced diet through the IV. There was a long time between writing the TPN and getting it to the patient, and a short time, just 5-6 hours later, we would get the results and say, did our change have the effect we wanted? We really probably weren't giving it a fair chance.
CHKD was able to develop a standard for producing TPN and improve the process for preparing the machine that creates TPN. These changes reduce stagnation, creating continuous flow of product, greatly reducing lead time.
Not only that, but the form itself communicates directly with the compounding machine. They were able to shave off even more time.
It's now all done online. It's cut down what was a 3 or 4 or 5 hour process to literally instantaneous. As soon as they order it, it goes straight to the pharmacy.
So now we've got about 12 to 13 hours of the new fluid going in before our laboratory studies tell us that we need to adjust it in some way, which is a much fairer shake. For us to give them this nutrition over long periods of time and allow them to grow, we need to use what's called a central line, or a line that goes in to a large blood vessel, but they have risks. And the biggest risk of a central line is an infection associated with the central line. Infection is bad for anybody, but can you imagine how much worse it is for a baby who fits in the palm of your hand?
With regards to the central line work, the work with TSSC did establish one standard practice. It's easy to not only train to, but also hand off a process to somebody because they know what the expectation is.
So in 30 days, we trained 220 nurses on a new way to manage lines. In the past, that would have taken 6 months to a year to do.
Anything we can do to prevent infections has a dramatic effect on their survival.
All healthcare providers know the importance of hand hygiene, but they may not know how long they should wash with soap and water, or they may not understand the importance of the friction using a substance such as Purell. What the hand hygiene efforts that occurred with TSSC were more related to standardizing how we did hand hygiene.
It was creating job instruction sheets and instituting an auditing process to watch that, to see that people were doing what they were supposed to do.
That not only involved our staff, but also involved our families.
So it was actually the visualization of, okay, this is where we were, and this is where we're going.
It's not big steps, it's the little steps that deliver big change.
Toyota didn't come in and tell us how to fix our problems. They taught us how to problem solve, how to break down a big problem into smaller pieces that are easier to handle.
It was all about doing the best thing for the patient or the customer.
It's not about me as the bedside nurse. It's not about me as a director. It's about what we can do to make things better for the babies.
Toyota has been involved with this for 25 years. My God, if every company did something like this, the world would be a better place. For me and my colleagues and my little patients, Toyota has given us a step back and allowed us to make changes that have honestly saved lives.